this is the thing. And I stress this out a lot to a lot of people. And I have this thing, and I tell a lot of people, you know what? I'll go out of my way to get in a way if it's going to help you.
Hey folks, it's Alex with Community Project. I'm here with Harold with the Recovery Café. And you're not just with the Recovery Café, are you?
No, I'm not.
Oh.
I'm tied into the Recovery Café. I'm part of the State Opioid Response. And I'm also, I guess you can say, part of the all-road shelter now. Yeah.
Okay, well,
Yeah.
I'm glad there's three of you because those are all full-time jobs. What is the State Opioid Response? We talked to Victor a little bit about it, but Can you tell us a little bit about it?
Yeah, so the State Opioid Response is a thing that's Behavioral Health Administration put on, and it's really to kind of address the opioid epidemic that's going on in the communities. And there's a number of counterparts I have that's in that. I can't tell you the exact number right now, but I think it's probably at least a dozen or more.
Around the state.
Around the state.
Yeah.
I'm the only one in Boulder County at the moment.
Okay.
There's one that's coming that's part-time that's also going to be help working on it. But basically, I worked the entire Boulder County and addressing people on substance use with opiates or stimulants.
Harold, to me, it sounds like you need to be on stimulants if you have to cover the entire Boulder County. That one person for the entire county? Or?
Yeah, under the State Opioid Response.
Okay.
Yes.
Do you think that's enough?
I have this saying. There's a saying in recovery. It's called "One's too many and 1,000's not enough."
Mm.
And I believe that one person out there suffering is too many, and 1,000 of us out there helping them is not enough. Yeah.
Do we have any idea of how many folks in Boulder County have opioid problems?
I do not know that number right now,
Okay.
but I can tell you it's substantial.
I mean, are we talking over 10,000? Do you think it's...
No, I don't.
Okay.
I can't get into the numbers right now because,
But it's a lot.
There's a lot out there.
Who else does it fall on aside from you to help with this?
There's other people out there helping address the people, the communities. There's Focus Reentry. BHAP works with a lot of people too. Feet Forward. There's them. There's a lot of people out there trying to adjust them. All Roads has people out there addressing these people as well.
But that they handle, most of those organizations work with folks that are unhomed, correct? And I mean, that's a little bit different than what we're talking about here with the opioid crisis, right?
And so, I mean, there's multiple, programs, around the state to put these people in. As far as the people going out in the community, addressing these people on a substance use, I haven't really ran into hardly anybody that's really focusing on that in the community.
So you're kind of the lone voice out here telling people, I can help you? I
can help you. And I've kind of filled that gap that's going on in our community in Boulder County. I mean, there's some organizations you can go into and talk to them, and you can tell them what's going on with you, that I have a problem, and I need help. And, and I'm sure that they will assist you. There's a lot that'll call me. I try to be connected to everybody, including people at the jail. There's the MAT clinic you can go to. There's 2 MAT clinics in Boulder that I know for sure. And
is it MAT?
MAT, Medicated Assisted Treatment.
Okay, MAT clinic.
You can go in there and get help as well.
But they're limited beds.
So the MAT clinic doesn't have beds.
Okay.
It's a outpatient clinic. You can go in there, you can see the doctor, whatever, and work on getting on some medication like methadone or Suboxone or Sublocade or naltrexone, to help you with your withdrawal and stuff like that. As you try and
do you work with the MAT clinic?
I refer people there.
Okay.
Yep. I've brought people there. Yep.
So that's for just outpatient. So
that's outpatient.
Maybe if they're not so bad.
Well,
or they can't go to detox, or they
so most people go to medicated detox, or it just all depends on how bad you are. There's people that goes to withdrawal management. It's a very complex issue because people are at different levels, and it all depends on a lot on the amount you're using, and how bad off you are. If you use opiates or fentanyl, The withdrawal from that is it's horrible. I mean,
for the audience, like, what does that look like? Can you tell us
what it looks like?
Yeah, just so how bad is it?
How bad is it? It can kill you.
So what's the process? Can you tell us a little bit about the process of what the withdrawals
are? Yeah, you're sick, and a lot of people refer to it as being dope sick. And what that is, you can't do that. You are very ill, and you can't really.
Are we talking like flu symptoms or like dysentery?
I'd say worse than that.
Worse than both? It's like both having the flu while you have dysentery?
Yeah, it's kind of like, I mean, it can be coming out of all ends.
And how long does it last?
All depends on how bad you are. If you're a constant user, it can go on for a while.
A week?
Longer.
Longer than a week?
Yeah.
You feel that?
It can kill you.
So that's what people are afraid of, right?
Right.
So they have medical assisted detox and that?
Yeah, medical assisted detox. You can go to withdrawal management.
So people shouldn't be doing this on their own, probably detoxing by themselves.
You shouldn't. If you're on opiates, you shouldn't be doing that by yourself.
Okay.
No.
It's life threatening to.
It can be life threatening. Yeah. Yep.
And then at the same time, we don't have very many facilities and resources to be able to help these people get off the drugs.
I think that there's a lack of beds. Yes.
Okay.
I believe that because I place a lot of people every week in the programming, and I really worked hard at establishing some good relationships with different programs to kind of help, speed up the process of getting you into programming. Because a lot of times it'll take you a week or 2 weeks. It could be up to a month that you're waiting for a bed. And
people are just doing, I mean, they're not stopping doing drugs at this point. They're continuing to do drugs. So they're putting their lives at risk, maybe for overdose and that entire time.
That can happen. Yeah. That goes into a whole nother thing itself. When you're in the middle of your substance abuse and addiction, there's windows of opportunity to open up. That maybe you just like had enough. You're just sick and tired of being sick and tired. Or maybe you're contemplating, it's called the pre-contemplative stage, where you're thinking about, maybe it's to change, But there's windows of opportunity to this. Sometimes when people are going through withdrawals, they're not feeling good. They just get tired of this and reach out and want help, But those windows are short-lived. It could be a matter of an hour, or a day. It all depends, But like with the opiates and stuff like that, the only thing that's going to make you feel better when you're going through the withdrawals is if you continue to use.
What does methadone do? So someone's on.
Methadone. What methadone will do is it helps with the withdrawal symptoms.
How long do people typically stay on methadone? What's the process of that?
There's people who've been on it for years.
You just stay on it?
You can stay on it.
Yeah. Is it similar to meth? Do they have the same sensations, or is it?
I've never done it myself.
Okay.
But no. I think
it just helps with the withdrawals.
It helps with the withdrawals from opiates.
Okay.
And people go. There's a methadone clinic, right here in Boulder. There's one in Longmont. They're around.
Okay.
Yeah, and there's people on it, that need to be on it. I've seen people try that just stop using it, and that's not a good thing either.
Is that a free service, or is it billable by insurances, or
usually Medicaid?
Medicaid pays for it.
Yeah.
Harold, what makes you the expert on this? Why are you so good at your job?
I'd have to say lived experience. I dealt with substance abuse for decades, and it started when I was very young. I learned what substance abuse was when I was 11 years old, and throughout my life, I've dealt with it and I lived with it. For a long time, I was a functioning addict. And a lot of times, I kept it very well hidden and nobody knew about it. And that was part of being the functioning addict part.
How long were you on that track?
Almost 30 years.
30 years.
Yeah.
Wow.
And I've been sober for going on 9.5 years. 100% substance free.
And how long have you been doing this work?
I've been doing this work for about 3 years.
Okay.
Yep.
What were you doing before that?
I was in prison
Oh,
for drug trafficking,
okay.
possession of meth. You know,
What made the change?
um, I just had enough. It's not a good life being hooked on substances. It's really not. I mean, it's a downward spiral.
Yeah.
And being on it for as long as I was, which I was a heavy user. Um, I paid very dearly for it by getting caught with it, being in trouble, because of it, distributing it. And I sat in prison. And when I got to prison, I knew I was done. I just didn't want it anymore. Just all the things that I've gone through in my life because of it. I was caught in a home invasion, just a lot of different things. I've seen a lot of really bad things happen out, to people. And
did you have to go through detox in prison?
So, yeah, that's a whole other thing. Going through detox in prison. When I went in, no, there was no detox. It was like instant cut off.
No detox. You just didn't have
not
it.
When I went in prison, no.
Okay.
And but you know what? I was happy that it was over. The last time I got in trouble, I feel like it was a rescue. I was just happy it was over. And I have a few years of rehab in, but I'm a very motivated, driven person. And, and I fought hard against it, and, during the times of rehab, they teach you, all the things that they teach you and tell you these things, one day at a time, just the things I learned in programming. Most times that I was in programming, I was in there just because I was forced in there. And I didn't want to be there. So I had ulterior motives the whole time. I was going to do what I have to do. I knew what I was going to do the day I walked out of there. Because it wasn't what I wanted.
But do you think that gave you knowledge of what the process was like? So the future, you knew maybe it wasn't that bad and you had an expectation. So do you think it was a positive experience?
I do think it was a positive experience. Because even though I didn't want to be there, I learned a lot of tools.
Yeah.
And that's the key thing. And that's what the whole thing that programming is about. Learning the tools to help you succeed.
Can you give it, what are the main tools? Can you give us top three?
There's a lot of things. One of them, staying connected, with recovery, going to meetings. If you think, I tell a lot of people this, when you think that you don't need to go to a meeting, that's when you should probably go. Because I've done the meetings before too. And I noticed that, and I've witnessed this with a lot of people that I worked with too, when those meetings fall off, it starts to become a danger zone, because a lot of things happen. Going to meetings, you're staying connected to people that have the same mind frame that they want to stay sober. Not going to meetings, being bored, staying busy. Being bored is a big sobriety killer. Because when you become bored, you start thinking. And sometimes you start thinking about things you probably shouldn't be. Start thinking about people you used to be around. And maybe you miss them. And you might want to call them and talk to them, but, I've gone down that road too. And it's led me to failure, and I try to stress this to people, but, that's one of the tools. The other thing is, not hanging around people that are using,
A lot of times people that are in recovery, their whole community is probably using. And then when they come out of recovery, they don't have a community any longer. Is that what you see?
Well, what I see happens is a lot of these people that go into recovery, what I recommend is go far from where you were. Go somewhere, substances are everywhere. Our communities are sick with substances. I mean, they're everywhere. You're not going to get away from that. But by going through programming and stuff like that, it gives you time to build strength and resistance to that. And, you're making connections in the recovery community. You're going through cognitive behavior training groups.
Can we touch on that for a minute? Like, what does that look like? The cognitive behavior treatment.
Cognitive behavior thinking.
Yeah.
The way you're thinking about things. It has to do with being rational and thinking about things more properly instead of like
So you train yourself
not
how,
having
training yourself how to
like
think positively around
be more
scenarios.
positive about it, just how to handle stress and stuff like that.
And that's something you learn in.
I learned that.
In recovery, or
I learned that in recovery.
Okay.
I learned that in prison. And those are some of the things I did. When I went to prison, I was done. I knew what I needed to do. I needed to work on me, and I did. I didn't talk to anybody outside. All the people I knew, I totally cut them off. I had to, because I knew I needed to do that. If you're trying to stay clean and sober, it ain't that easy if you're hanging around people that are using. And using with people, you create a bond and you become close. But the using is the bond. And it's hard, but you know what? Even when you care about these people, you know what? I had to explain to them, I'm going down a different path, and I'm sorry. And
so you cut ties with your
I cut
social
ties
groups?
with all of them. And
have you ever seen them since?
No, I moved 1,000 miles away.
Okay.
Yeah. And I contribute a lot of that to my success in being substance free.
Did you know anyone where you moved?
No.
Wow, that's how serious you took it.
I knew what I needed to do, and that's what I needed to do.
Yeah.
The whole time I sat there, I worked on myself. I knew that I needed to stop. I needed to cut myself off from these people, because that was the only thing that we had in common was using substances. That's the only thing that mattered, because that's the life to live, and that's not the way to go. And I did. I cut them off. I cut them all off, and when it was starting to get close to me getting out, I went into a prison treatment program, and I was in that one for about approximately a year. And during that time, I really focused on my thought process, having expectations and assuming things, surrendering. That's another big tool that you learn in recovery. Surrender is a big thing.
Tell me what it is.
Surrendering is becoming brutally honest with yourself, and with what's going on, admitting that and realizing that you are powerless over the substances that you're using. That's surrendering. Not having to have the upper hand, or I got this, or having the will. Moving over and letting somebody else have will. That's what surrendering is. So
you let other people help you.
I let other people help me.
Yep.
I had to come to the realization that, I have a problem and I can't do this on my own.
So that was the first step, probably.
That was the first step.
Okay.
Yeah.
Yep.
And that's a big step.
Yeah.
It's being honest with yourself.
It's the biggest step, probably.
Yeah.
Everything's downhill from there, right?
Yeah. And a good example of that, is I smoke cigarettes. Okay. I can tell you, I'm gonna quit tomorrow, and I'm gonna tell everybody I'm gonna quit tomorrow, and set a goal to that. Deep down inside, I know damn well that that's not gonna happen. That's part of being really honest.
Yep.
I knew it was going to happen if I went back out there and went back in the same community. I knew it was going to happen. I'm getting out to nothing, no money, and I'm going to do what a lot of people do. You're going to go back to what you know, into your comfort zone, where you're going to get some money and you're going to get some help, and it's a vicious cycle.
So 9 years ago, you were sober. So you've been sober for 9 years.
9 years.
You spent 6 years in prison?
Almost just about 7 years this last time.
Okay.
And that was my second time in prison.
Okay.
For the same thing.
So you got out, and then how'd you get hooked up with Victor?
Okay, so when I got out, honestly, I struggled. I started looking for a job. I got rejection after rejection because of my criminal record. And it's all filled with drug charges.
Mm.
And I knew about reentry, because you see reentry in prison and jail and stuff like that. And so I realized, I need help. And so I reached out I looked on Google to find out where the reentry initiative was. And I did. I live in Boulder, and I came to Longmont, and I found it. And that's also when I found the cafe.
So we're talking about Recovery Café.
Yeah, the Recovery Café. I met Chris Poma, the program manager, outside. I asked him if he knew where the reentry initiative was, because that's here too. And he's like, yeah, you're in luck. It's right upstairs. And so I did. I came to that place and here at the same time. Um, when I came here, I was welcomed in by the staff. And they started talking.
And this is before you met Vic.
This is before I met Vic.
Yeah.
And they started talking to me. And I realized that this is where I needed to be. This is me. Because the whole time I was in prison, I started thinking about ways that I can probably help people, and get back to the community. And, and so Chris hooked me up with Victor.
Which one? Is he
the program manager there?
Right there, Celebrate Everything?
Yeah.
Okay.
He hooked me up with Victor King.
And that's the executive director right beside him. I thought you were talking about.
That's Jen Jepson.
Jen, okay.
Yeah. But he hooked me up with Victor King. And, and I went upstairs too. And they mentioned him as well. And so I reached out to him. And he got back to me. And so then, and during this time that this process went on, I started coming here, and then I started volunteering here, because I wanted to do more, and this was my way of giving back to the community. And so,
were you living in Longmont, or were you in Longmont at the time, or you?
No, I used to take the bus here, and I'd come here and volunteer, and that was this, I got a job because of the reentry initiative. I got a job in Boulder. And so I worked that job is in a tofu factory. And when I wasn't there, I'd come here and volunteer. So yeah, I'd take the bus and get on the bus, come here and volunteer. I'd come here in the morning and volunteer, and then I'd leave here and go to work in the afternoon there. And then after I met Victor offered some training, so I started going through those.
That's the peer support.
The peer support training, yes. The recovery coach training I did with him.
And that's under the opioid.
No, that was through CCAR.
CCAR, okay.
Yeah, which is an organization. I think it's out of New Hampshire, I believe it is. But they're all over. They have training there. So I started doing trainings in his class, and I was full of questions. I want to know more. Because I want to be able to do more to help people. And from there, I took a training over at the Ryan Wellness Center through Mental Health Partners. Through Choices, I took some training, and really I just kind of put a lot of things together. I did some mental health training, because I wanted to know what I could do and be better at what I'm doing is helping the people. And then after I did that and stuff, I volunteered here for a year. And after that, Chris offered me a part-time spot here. And I took it.
So what is I don't think we ever covered what the Recovery Café actually is in this conversation. So
okay, well, the Recovery Café is a safe, sober environment, that you can come to, and it's not just being in recovery from substances or anything like that. The Recovery Café is not a cafe. But, it's a place where you can come and there's a warm meal here. You can get coffee or tea or something to drink or snacks. And there's some supplies that you can get, things you need. I have a bike program here. If you're out there actually looking for, a job and you're doing good for yourself, I'm going to supply you with the bike. But you can come here. They have recovery circle groups here. They have men's circles here, women's circles here. There's outside programs that come in here. Like Smart Recovery comes in here, and there's AA that comes here on a weekend.
So you work with other organizations as well, then, I guess? Yeah,
there's other places that come in here and they'll do some special training things. There's a thing that was just here called Parents of Addicted Loved Ones. It's a little thing that they had going on, a short-term thing.
The services are free, correct?
Everything here is free.
Wow.
Yeah, and it's about being in recovery. Everybody's in recovery from something. It doesn't have to be substances. It could be mental health. Maybe you're in recovery from loss. Maybe you're going through some hard times right now or having some issues and you just need somebody to talk to. And that's what the Recovery Café is all about.
That's wonderful.
It's about building connection.
Yep.
A safe place for you to come. And we offer a lot of things here. There's musical instruments here. You can come and do meditation. You can come and just be by yourself and sit at a table and do puzzles, paint, There's guitars, piano. There's a lot of different things here.
How often are you open? Is it every day?
It's open Tuesday through Saturday right now.
Tuesday through Saturday.
I believe in July the hours are going to change from Monday through Friday. Right now, Tuesday, Wednesday, and Thursday it's open from Tuesday is open from 11 to 7. In the morning part, they do a co-ed recovery circle. In the afternoon on Tuesday, they have a Spanish circle. On Wednesdays, they do art and more, or they'll go out and walk in a community, or, just kind of do other things. They do a meditation. On Thursdays, they do TED Talk Thursdays. And, that's when you come in and you watch some TED Talks and then you discuss them. The different topics that was in the TED Talk. The other thing they do too is when you come in here, you come in at 11, they offer a warm meal. And we sit down and just kind of congregate against each other, build connection, receive some support. And then you'll go into these circles or the TED Talk. Friday, they have open mic nights on the first Friday of the month. And people from the community, it's an open night for everybody. People from the community come in, and it's very interesting. Come in and tell a story, read a poem, or maybe you just want to come in and tell your story. And that's what it's all about. It's giving you the opportunity to open up and to share. Share who you are. Maybe you got some talent. It's an opportunity to express yourself.
Yeah, that's wonderful.
And it's a very non-biased place. Everybody's welcome.
That's fantastic.
Yeah. We just ask that you stay sober in the space. That's one of the things that we ask you. So
that seems reasonable.
Yeah.
For the Recovery Café.
Yeah, Recovery Café is amazing.
So back to Vic though. What do you guys do? What is that whole program about?
The State Opioid Response?
Yeah.
Okay, so Victor is my supervisor.
Okay.
And he oversees all the the peer support specialists that are out there working under that across the state.
How many do we think we have?
There's over a dozen of them.
Okay.
Yeah. They're in Colorado Springs. I believe there's one out by Steamboat Springs. They're everywhere. Down in Denver. There's one in Fort Collins. They're all over. And
what's the goal?
Huh?
What's the goal?
Is to help people that are suffering from opiates and stimulants.
To actually get people into rehab?
Yeah, get them into the rehab, into programming, to offer support to them.
We were talking earlier when we were outside about how dirty your car was because of your recon missions or your retrieval missions, I guess, huh?
Yeah. Yes.
You were up in Nederland and in the back roads and four-wheel driving to get into people.
Yes.
How did they even contact you, and how did you know to go there?
I go out there and look for them.
You go into the woods and look for people.
Yep.
And what do you do when you find them?
I talk to them. Okay. I introduce myself to them, and start a conversation with them. Share with them some of my experience. I've been here, how can I help you today? I carry some supplies in my car. If you're out there with nothing, laying under a piece of plastic or something, I have some sleeping bags, and you just kind of start building trust and building a relationship. You're not going to get rescued on the first time that we meet. We got to get to know each other. It's a matter of, just talking, holding a conversation. Sometimes what people need is just for you to come and listen, and that's where it starts. And I want you to know that I'm out here to offer you support to you. Maybe you just need some talk. Maybe you need some help getting through things. It's what can I do for you today? You're hungry. I got some food. I'm gonna give you some food.
Yep.
You're cold or you need some shoes. I have sweaters. I do drives to get donations to get things. And so I carry things in my car and I'm going to give it to you. If you're cold, I'm going to give you a sweater. You're wet, I have some ponchos. And we're going to start,
Who funds that?
Huh?
Who funds all the supplies?
I do snack and hygiene drives. And so I gathered these donations. And so then I get this stuff off Amazon.
Okay.
Hope is donate some things.
And
People
Hope is
that
the
come here.
shelter in Longmont.
Hope is
correct?
the shelter in Longmont. They brought some things to me. There's people that come in here that donate things.
Okay.
I posted online asking for donations of things, and that's how I got my stuff.
Are you doing that through Recovery Café then?
I do that on my own.
You're working, you're not currently, but are you working under someone else's nonprofit and you're working on getting your nonprofit?
I'm working on my own nonprofit. I've established it.
Okay. Are you a
I'm setting it up.
501c3 right now?
No, I'm in the process of all that right now. Yeah. Because of the changes that are currently going on, I've also had to implement some changes as I'm going through this, but I'm in the middle of that process now.
And what's your organization going to be called?
Our House.
Our House.
Yes.
Nice.
Yeah. And it's going to specialize in transitional housing, sober living, and PHP.
Tell me what transitional housing is in this model.
In this model?
Yeah, in your model. What does it look like?
It's going to be a structured, supportive environment for the people that are coming out of prison and jail.
Okay, specifically for that?
Yeah, it's going to be, and there'll probably be some other people in there too. I'm set to expand. That's just what I'm starting out with.
Okay. Traditionally, I think there's halfway houses, right, that people can go into after prison. Is that?
Yeah, there is, but there's a waiting list for that.
Okay.
There's not enough resources. There ain't enough resources for everything all across the board.
Right.
No matter how you want to look at it. But I know, like, when I got out of prison, and then, I work with a lot of people that got out of prison. They have nothing.
Yeah.
And
a lot of times people go to prison and lose their family.
They lose everything.
Lose their house, lose everything.
Yeah.
Right?
Mm-hmm.
A couple bad decisions and you got to start from scratch.
Yeah. People regret making the wrong choices. A lot of people that are out there in our community right now, they didn't get there making the right choices either. There's a lot of things that play into it. So the transitional housing is about helping people that are coming out of prison and jail, giving them a place to go. Eventually, I plan on having wraparound services. That's my goal. And
that would include mental health treatment?
Yeah.
Drug and alcohol treatment, I'm imagining.
Yep.
And what else would that entail?
So, I'm going to start with PHP, and I plan on that being open within the next couple months. I've been going through the process, all that. I have a clinical team put together.
So what's PHP?
It's partial hospitalization.
Okay.
Stuff. It's like the step between residential and sober living.
Okay.
Yeah. It's a step down from being in residential and patient treatment. Where you're going in kind of day services, you're going in every day and doing programming, and getting help and stuff like that. So there's going to be groups and counseling going on with that. Wellness groups, relapse prevention groups, stuff like that.
How can people help you get this going if they wanted to? What do you need the most?
Right now, donations.
Okay.
With the way things are going with the grants and everything, things are unstable. I'm working on gathering donations. I'm going to be putting together a fundraiser, and I just had to wait until I got a little bit farther where I'm at. And funding. It's all about funding. Every little bit helps. And it's worth it because you're helping somebody get a better start. It's giving them a hand up.
And when you're a 501c3, that'll be tax deductible. So
yes, it's going to be tax deductible. 100% tax deductible. Yeah.
What do you think the biggest barriers are, aside from funding, to get people the help that they need? And I have a couple things on the top of my head that I have noticed that are significant barriers.
Yeah.
But, what do you think are, aside from funding?
Okay, so a big major barrier is people that don't have documents, that lost their documents, or people that don't have documents. There's not much for people, undocumented immigrants. These things
we're
are
not just talking about immigrants, though. We're talking about people that actually lost their IDs.
In general, people that lost their ID, lost all their documents, don't have a birth certificate, no social security card, no ID. You don't have any documents. There isn't a lot that can be done for you.
And if you're living on the street, that's just one time your backpack gets stolen, potentially.
Yeah.
And you're done.
Yep. And that happens, and it's very real, and it happens
every day.
a lot.
Every day.
Yep. People get robbed for their stuff, too.
Yep.
There's a lot of things that are going on out there in the unhoused community, And, you lose your documents. you're in a real mess then. You know, it's hard to get on housing. You need
You can't even
documents.
find work.
You can't even find work.
Nope.
You know, what happens if you're going to get public assistance? You need some documents.
Yeah.
You know, most of these programs, you know, there's a couple that have scholarships, but if you don't have Medicaid private insurance, you can't get in.
And you probably can't get Medicaid unless you have your documents.
Right, you need documents.
Ugh, it's a horrible cycle.
You know, it's tough. You know, there's very little that you can get, you know, and with the way things are going, it's not becoming easier. It's going to become harder.
Yep.
You know,
a lot harder here in a moment, harder. Potentially, right?
And this one big thing that I've noticed too, people that undocumented people, they have nothing. You know, I scoured the areas trying to find help for them people. You know, addiction doesn't discriminate against anybody. You know, and neither is being unhoused, and it's hard. You know, I've dealt with a lot of people that are undocumented, and it's hard. You know, everything's very limited.
You think with the amount of technology that we have as a society, we wouldn't need little paper cards to identify us anymore.
I know.
It's unbelievable.
It'd make things a lot better.
Yep. So we have funding, having your ID and getting through the red tape of the situation. What else are some of the issues that make what you do challenging?
That make what I do, you know, about getting as far as getting people help. You know, there's a lot of things that play into it. There's some people out there that are scared. You know, there's some people out there that don't want to get help. You know, there's some people that are in a frame of mind that, you know, they're lost. You know, you can't force somebody to do something that they don't want to do. And that's really a big thing.
The drugs, alcohol,
you know, getting help, you know, people need some help, you know. I mean, they do have involuntary commitments and emergency commitments, you know, and I think that those are necessary. You know, I wish that they're a little bit easier because this is one thing that I have noticed. Sometimes, you know, I work with people coming out of jail, okay? And one thing that I learned is from seeing the people in the community out there doing their thing, when they go to jail, they start getting a clear head because they've been taken away from that. Mm-hmm. You know, and I try to catch those people while they're in there.
So you actually go to the jail?
I go to the jail to visit people. You know, I work with different organizations that are in the jail, and you know, we work together on people. You know,
do you identify people with these other teams? Is that how?
Well, so the people that go to jail, I'm on a call list, and I'm also a free call from the jail.
You're a free call?
I'm a free call from the jail. You can reach out to me. Yeah.
That's great.
Yeah. I try to do everything I can to make it, you know, as easy as I can for you to reach out to me, you know, because.
And that's why you carry all those mobile phones.
That's why I carry all those mobile phones. Yep. You know, I carry a lot of stuff, and you know, I've become very well known in the community, you know, through the police, through everybody, you know, a lot of people in the justice system, parole, probation, you know, I've become very well made aware of, you know, and that's the thing is sometimes when people go to jail, they start getting a clear head, you know, after you've been off the substances 4 or 5 days, they start, you know, thinking more rational. Let's do this, you know, they start talking to other people, you know. There's organizations in the jail that will work with you. If you send out a referral to them, you know, they'll reach out to you. You know, there's BHAP, you know, goes there, Focus goes in there. You know, there's the JMAT team goes in there. You know, I've talked to
now?
The JMAT. That's the medicated assisted treatment. That's the jail medicated assisted treatment. That's where you can go get on Suboxone and stuff.
Got it.
But you know, I've talked to them, you know, and they can help you too, get you placed. I'm not the only one.
And I can vouch for how well known you are in the community. Everyone I talk to is like, "Do you know Harold?" And yeah, we know Harold. So everyone knows Harold. That's a good thing.
I think it is a good thing.
You're helping a lot of people. How many people do you think you got this year alone? Have you got into treatment?
I'd say probably close to 500.
This year alone?
This year alone. Yeah.
Just yourself?
Just myself. Yeah.
Well, whatever you're getting paid, you deserve a raise, Harold.
Well, this is the thing. And I stress this out a lot to a lot of people. And I have this thing, and I tell a lot of people, you know what? I'll go out of my way to get in a way if it's going to help you.
There you go.
I'm very compassionate about what I do. And really, I work tirelessly. I end up working 7 days a week, um, because there's people out there that need help.
Yeah.
And sometimes when that phone rings, I'm going to answer that phone. And if it's that time for, that you're ready, I'm going to come and get you. And I'm going to get you in.
Can you utilize, would it be useful to you to have volunteers work with you? Could you utilize volunteers?
Um, I'll put it this way. I'm all over the place, but there's plenty of room for everybody to come out there and help people. There is, there's not enough people out there.
What if people want to work with you?
If people wanted to work with me?
Yeah.
I mean, that's possible. We could probably meet up and do some things together. There's some things, of course, I move around all Boulder County, so that's going to entail a lot of driving on your parts. Usually I'm very limited on space in my car, and I'm on the road a lot.
Well, what if, could you train someone, I guess is what I'm getting at, to help you? It seems like you know what you're doing and you have the systems figured out, and you need manpower, to me, or woman power.
Yeah, right. Well, like I said, there's never enough of us. I do have people occasionally come do ride-alongs with me. I think I'm
going to be one of those people. I think I'm going to be one of those people.
Yeah, you're welcome. Yeah, we can do that. We can set up a time, and you're more than welcome to come out with me.
Stay tuned for that, because I'm going to ride with Harold.
There you go. Yeah, I set it up. So usually, I just unloaded my car this morning, but the back, I drive a Jeep, and the back of my Jeep, I fill it up. I have some sleeping bags, some tarps.
How do you find the people? You just go look for them? You don't have any data to point you to the right place?
Well, so a lot of times, this is the thing. A lot of the people out there using substances are close by each other.
Okay.
So that makes it a little bit easier.
So you can find a group, typically.
You'll find them in groups.
Okay.
Because they got that bond that we talked about earlier. They're going to be close to where they can go out and find money, drugs. There's some people out there. There's some people that want to be out there, that are isolated. And those are the people that I go out looking for. There's some people, that they don't want to be harassed by other people. The unhoused community can, really fluctuate. And it's not the safest place to be. There are people ripping each other off, doing all kinds of things, and that's not a good thing.
Yeah.
I mean, as far as the people that are hooked on substances, I think we all know what happened last year in Boulder. Without bringing it up too much, about what happened with the young lady.
Oh yeah. Yep.
How much more of this stuff has to go on?
There's been a lot of stuff.
Last year, just in Boulder alone, over 40 people died. Most of those were overdose.
Yeah.
This doesn't have to be that way.
And we have people dying. They're freezing to death too.
Yeah, and these people freezing to death. There's people out there that have frostbite. I helped a guy. He was complaining to me about his feet, and told him, "Take off your shoes and socks. Let me see." And since then, he's lost over half his toes. His feet were wet. He had wet shoes. People are walking around like this. They don't have nowhere to go.
So let's switch to solutions now, Harold. What do you see as what can we do as a society to solve this problem? I mean, if we all banded together, it seems like we could probably figure this out, right?
Yeah, we definitely could. And my big thing is this: people need a hand up more than they need a handout. By giving these people a handout, I'm a very passionate person. I hand stuff out to a certain extent, but I also see what happens with a lot of these handouts. And that kind of concerns me as well. But people need a hand up. There's nothing wrong with helping people sustain themselves or giving them food or whatever, or helping them get by. That's one thing.
We're keeping them alive until they can thrive.
Yeah, but they really need a hand up.
What does that look like?
What does that look like?
Yeah.
If we all came together and started working together, maybe donating more to all roads, or help creating more shelter for these people.
Do you think there's a big debate now about the housing first argument?
There's going to be a debate about everything.
Yeah.
And that's part of what the problem is that, and how we all do need to come together and agree on things better than we do. The thing with the housing first, I run across that a lot. Where does this start? Where does it start?
Yeah.
How are you going to get help being substance free or whatever when you're out there right in the middle of it?
So do you think putting someone that's addicted to anything, really, or putting them into a housing environment is going to be successful?
Well, that's where it starts.
Getting them into the house starts.
House.
But what if they don't have the other services that they need?
Well, and that's why we need to come together.
Okay.
Because I do go into these places where people are suffering that did get housing. And I do my best to try to help them so they don't lose their housing.
Okay.
Or to help them move forward. There's other people, they have case managers and stuff like that are helping these people.
People are kind of in danger of losing their housing voucher, though, if they go into treatment. Is that correct?
There's exceptions to that.
There is.
And treatment is one of them.
Okay.
There's the steps you have to follow, and you can maintain your housing.
So there's no barriers for someone except the lack of facilities and beds for people.
Lack of facilities and beds, and now funding, because the way things are changing.
Do you have any idea how much it costs for one person to go through treatment? How much it's billed?
Yeah. Right around. The minimum is right around just about $10,000 for 30 days.
$10,000 for 30 days.
Yeah.
That's not that bad.
No.
So a sponsorship would look like $10,000 if you wanted to sponsor one person to go through treatment, because I'm imagining there's a lot of people that do not have Medicaid.
Yeah. There's a lot of people that don't have Medicaid.
That can't afford to go to treatment.
Right. And
they can't afford a little bit of.
And this is one thing, like Signal, there are some scholarships for people out there that don't have Medicaid. Because I've been utilizing those through programs that have those by getting the people that don't have nothing in.
Okay.
So there are some scholarships out there.
Any idea how many?
I do not.
Is that county based?
I think that's statewide.
Statewide?
Yeah. But they're very limited,
Okay.
And some of these places ran out of scholarships already,
So is that something maybe you would be doing with your organization, is setting up scholarship programs for this?
Yep.
Okay.
Mm-hmm. Yep. And that's a big thing for me, and that is it's really all about helping people move forward.
Yeah.
Everybody needs money to survive, and
well, they actually just need food, shelter, water, clothing, right? They don't need money.
It takes money to get all that.
But they don't necessarily need it. We can get them those things.
These people can get on food stamps, but the organization, the places that I'm setting up, there's going to be food there.
Yep.
And I'm going to be working a lot off donations. But there's going to be food there. I don't like turning people away.
Yep.
It's hard. What do you do?
You don't, I guess. Yeah. You have to keep trying until you don't have to turn.
Keep trying until I can.
Yep.
I work tirelessly every day out in the community, doing what I can to help try to make a difference. It's my way of giving back to the community for the things that I did in my past. I never did anything to this community. I moved to Colorado. But by me also doing what I'm doing is help me forgive myself for being the person I was.
Burning off that karma, huh?
Burn off that karma. If you're out there using substances, and this is one of the things I learned in programming, that they brought up to me. Think about what you did to the community.
Yeah.
And you maybe think, I didn't do anything wrong to anybody. Well, I have this to point out to you. It doesn't matter if you did something right or wrong to anybody, but if you're out there using substances, where do those substances come from? What have they gone through? What have the people gone through in order for you to get those substances? You don't know. None of us do.
Yep.
Well,
the people that are probably supplying that aren't the
right
best people out there.
Going out in the park, you go out in the parks, you see things laying on the ground. That's damaging. How do you explain it to your little kid when they say, "Daddy, what's that?" Or what happens if somebody steps on that? That's not good. You know,
That's not good.
And that's another thing I take up upon myself too is I have things in my car that I stop and I pick those things up.
Yeah.
You know, I don't want nobody to step on that.
And you got a Sharps container in your car?
I have Sharps containers.
Good.
I have Sharps containers to hand out. Yep. I have wound kits to hand out.
That's great.
But I do. I always carry Sharps containers.
I just want to make the point here that you would not be doing all of this if you hadn't gone through everything that you went through. So, I mean, it was kind of, I know it was probably hell to go through it, but for our community, it's a blessing.
Thank you.
So I hate to say it, but I'm glad you went through what you went through, Harold, because you're sitting here now.
Thank you.
Helping everyone.
Yeah, I went through a rough time, but you know what though? When I think back on it, it made me into the person I am today.
Yeah.
And I wouldn't take that back for anything. You know, because really I'm all about the community. I'm all about helping people in the community.
What would you say, and look into this camera if you would, and tell them from your heart how you feel about the whole thing, how you feel about the individual that needs help, and what would you tell them?
I'll tell them, so I'm going to tell you this. There's people out there that care about you, you know, and if you're out there using, I encourage you, please make a phone call. You know, you can call me, and I'll give you my number. It's 720-584-6999. I will help you move forward from where you're at. You know, if you're looking to get free from substances, you're not alone. I'll walk with you through that journey.
And if you guys out there happen to want to help Harold, you now have his number. So I strongly suggest you call him. Thank you, Harold.
You're welcome.
Thank you for everything you do.
Thanks.
And it's an honor knowing you.
Thank you.
Thanks, folks, and we'll see you on the next episode.